going on, everyone? It's Alex here from Aleks Physio, and today we're going to be chatting about scoliosis. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia. Today we're going to be chatting about scoliosis. So what is scoliosis? It's a type of spinal deformity in which there's an abnormal curvature of your spine to the left or to the right of 10 degrees or more in your low back. The normal curvature of the spine is basically an S-shaped curve. So what you have there is arching of your neck, rounding of your mid-back or thoracic spine, and then arching of your low back. So it resembles an S. And then when there's scoliosis, then this curvature is changed. There's that deviation. And we use a technique called the Cobb angle or the Cobb method, where we take the x-ray and you look at the highest vertebrae that has the most curvature and the lowest vertebrae with the most curvature, and we find what the angle is that creates that scoliosis. There are 3 different levels of scoliosis: mild, moderate, and severe, and based on how many degrees there is in the curvature. So 10 to 25 is mild, 25 to 45 is moderate, and over 45 is severe. Some people can have a compensatory thoracic curvature because of their low back scoliosis and can get a double curve or a thoraco-lumbar scoliosis. There are 6 different types of scoliosis. Adolescent idiopathic scoliosis is the first and most common. Number 2 is adult scoliosis or degenerative scoliosis. Number 3 is neuromuscular, so individuals who have neuromuscular conditions such as CP or Chiari malformations. 4 is congenital. 5 is traumatic or infectious, so people who get infections in their back or who have undergone a traumatic injury can develop changes in the curvature of their spine. And then number 6 is iatrogenic, so adjacent segment disease or flat back deformity or proximal junctional kyphosis, which is basically changes in your curvature that have been associated with involvement in the medical system, either via previous low back or spine surgeries or other sorts of treatments that have affected the curvature of your spine. Today I'm just going to be chatting about adolescent scoliosis and also adult scoliosis. So I'm going to talk about 2 of the 6 just for simplicity purposes. So adolescent idiopathic scoliosis can affect up to 90% of individuals. It's important to know that most won't require surgery, and the majority of people just go through their lives having scoliosis and not even be aware that they had it, because scoliosis is poorly correlated with how much pain you have based on the degree of the curvature. So for example, if you have a 10 degree or a 15 degree scoliosis, it's not going to be X amount proportional in terms of how much pain you have, because this is something primarily in the adults that progresses quite slowly. Now in the adolescents, scoliosis can progress a lot quicker or has the potential to progress quicker because of the fact that our bodies are still undergoing that skeletal maturity and rapid changes in the shape of the spine, the ligaments, the tendons, the muscles as you continue to grow and as you continue to age. So there are a couple of different treatments for scoliosis in the adolescent population that's different than the adult population. So in the adolescent population, some may recommend using a brace or wearing a brace for 23 hours a day. Now this is obviously quite challenging, can be, especially for an adolescent, just from a mental health perspective. Having to wear this, and you have to be very diligent in wearing it for a long period of time to try to not necessarily decrease the amount of degree of curvature that you have in your spine, but to try to slow down the progression of the curvature. And then the other option is surgery. This is usually done less frequently, just because obviously there are a lot of factors that need to be considered, and there's a lot of change that can take place in that adolescent years that may result in wanting to delay that surgery because it is quite a lengthy surgery. The other thing to be mindful of adolescent idiopathic scoliosis is the idea that exercises can slow or decrease the curvature. There isn't a lot of research that supports it. It can generally help with just improving your overall strength, well-being, your function, and your mobility, but to have a specific exercise or movements actually change the curvature of your spine would be very challenging, if not impossible to do, just because of how our spines are designed, and you doing these exercises for 30 minutes, an hour a day wouldn't be sufficient to actually change the curvature, because there's just so many other factors that are playing a role that exercise can't fix. So this is something that's very important, and what a lot of people ask questions about, just with regards to, can exercise change? And there's a lot of scoliosis specific exercises. It's important to note that while it can help, and if you eventually end up having surgery or not, with regards to your overall prehab and rehab, before and after surgery, and just your overall well-being, but the research to support that it can actually change the curvature of your spine or stop the growth of the curvature as you're growing is not there at this point in time. Let's chat a little bit about adult scoliosis. There are 3 different types. The first type is idiopathic. So basically individuals who maybe had adolescent scoliosis, they go on into their adult years and they continue to have changes in the curvature of your spine, albeit much less, because they have already reached skeletal maturity to the point that it may possibly become symptomatic as the individual gets into their 30s, 40s, 50s, 60s. The second type is degenerative, which is basically as we continue to be subjected to the forces of planet Earth, and as our spine continues to be subjected to these forces, there are changes that occur in our spine and our spine structure, and there can be degenerative changes and disc injuries, or facet arthritis in the joints of our back, or changes in the characteristics of our ligaments that can also change the curvature of your spine. Again, very minimally in the adult, but has a potential to progress once you have already reached skeletal maturity that you can get as you age. And the third one is iatrogenic. So this is a scoliosis that has been created while participating in the healthcare system, whether that would have been a previous surgery that wasn't a scoliosis surgery for your spine, or other treatments that can cause changes in the curvature of your spine. So 3 different types. Individuals with scoliosis, again, as I mentioned earlier, may not have any symptoms whatsoever. However, some individuals may have pain. They may have back pain, they may have leg pain, they may have neurogenic claudication, where the curvature of the spine affects the signals that are being sent to your legs, and you get bilateral leg symptoms, or cramping in your thighs, or limitations in your function because of that claudication, or the irritation of the nerves in the middle of your spine or on the sides. And then you can also get bowel or bladder issues, again, and this is in more serious case scenarios. When we look at our posture, there is something called the cone of economy, where basically when we're looking at somebody from the side, we're looking to see the balance between the head relative to our pelvis and our lower back region, to see what the alignment is, and if there is any deviation from that vertical or upright posture. When we look at some of the research, we find that how much balance you have, or how imbalanced you are. So if you're trying to stand upright, but the most that you can be upright is significantly leaning forward, then this can, and if you have scoliosis, and this is as a result of scoliosis, so you have a sagittal imbalance, so an imbalance in this plane of motion if you're upright, then this is a strong predictor for how much pain, disability, and reduction in your quality of life that you have. One of the best ways to look at the scoliosis magnitude is by having you undergo standing 3-foot x-rays, where we look at your spinal pelvic alignment. So x-rays that are basically looking at your entire spine, not just your low back or your mid back, and then done in a weight-bearing position where you're standing in 2 different positions, or they're looked at in 2 different positions, from behind or in the coronal plane, and then also from the side, to see how the curvature is and how the alignment is. And there's a bunch of different measurements that are then taken that the radiologist looks at to see how this scoliosis has affected your ability to be upright. So they look at numbers such as your pelvic tilt, how much your pelvis tilts forward or backwards, your pelvic incidence, looking at your SVA, or your sagittal vertical axes, talking about that sagittal balance that we were chatting about before, and looking at how much lordosis you have, how much arching you have in your low back. And then when we combine this imaging with your objective examination, so seeing how much this scoliosis has affected your quality of life and your ability to do your day-to-day tasks, and how much pain and how much disability you have, these can play a role in how big the Cobb angle is. As these numbers that we look at from the imaging plus doing the exam can help to determine whether or not you may need a possible surgery to help fix this deformity. And this becomes especially apparent as you get old because the curvature, if you already have scoliosis, has the ability to progress as you get older. Then this is something that would need to be assessed with one of the spine surgeons to determine whether or not surgery is warranted. However, the important thing to be mindful of with surgery is that, this isn't just a simple surgery. This is a 12 to 14 hour surgery. There's hardware that is being put into place to basically try to change the curvature of your spine so that you have more of a quote unquote normal spine, and try to restore that balance, that sagittal and coronal balance that you had. So if you're leaning forward quite a bit before the surgery, the premise is that you can be more upright following the completion of the surgery. However, because it's such a long surgery, it's such a long recovery time, there's a 30% chance that you may require an additional surgery because the hardware fails. All these things have to be taken into consideration. In addition to your past medical history, so are you a smoker, a drinker? Do you have diabetes? Do you have high blood pressure? How is the health of your bones? Do you have osteoporosis or osteopenia? All these things play a role in determining whether or not you would be an appropriate candidate to have surgery to try to fix the scoliosis. It's important to know that in adults, the scoliosis surgery is much more challenging because not only has the spine deviated from that normal curvature to the left or to the right, this has allowed your body to compensate to those changes in position. So it's not only the spine that needs to be changed into position or realigned with the surgery, but becomes much more challenging as you get older because of the muscles, the ligaments, the tendons, all of these, the nerves and the nerve tissues. All of this has to go along with it when you try to change the curvature. That's why it's such a major surgery and it's such a challenging surgery, because there's so much physical effort and force that goes into play in order to actually change the curvature of your spine. So there you have it. We went over scoliosis and some of the facts associated with it. Have you ever been diagnosed with scoliosis, or ever been told that you have scoliosis? What has your experience been like with the healthcare system? Did you end up having surgery? Did you go to physiotherapy? Let me know down below if you feel comfortable. And if you find value in my content, consider checking out some of my other videos. I have over 450 videos on various physio, exercise, and medical related topics. And if you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.